The quest for universal health care in the United States has long been a subject of heated debate, capturing the imagination and hopes of millions while drawing fierce opposition from entrenched interests. As the political landscape shifts, particularly within the Democratic Party and among the younger generations, the prospect of sweeping healthcare reform becomes less a distant dream and more a plausible future scenario. Yet, the road to universal coverage, whether through a federal Medicare for all program or pioneering state-level systems, is fraught with significant challenges and complexities. To understand where the country might be headed over the next decade or two, it's crucial to examine the shifting political winds, the obstacles in play, and the incremental changes that could pave the way for a more inclusive healthcare system. America's conversation about healthcare is deeply rooted in the nation's political identity and its unique blend of public and private systems. For decades, employer-based insurance has been the norm, with public programs like Medicare and Medicaid serving as vital safety nets for seniors, the disabled, and low-income individuals. However, this patchwork approach has left millions uninsured or underinsured, fueling calls for a more comprehensive solution. In recent years, the Democratic Party's base has moved decisively leftward on issues like healthcare, climate change, and income inequality, with younger voters leading the charge for bold action. The idea of Medicare for All, a single federally run insurance program covering every American, has gained considerable traction within the party. Championed by figures such as Bernie Sanders and Pramila Jayapal, polls consistently show that while support for such a program is strong among Democrats, the broader public remains divided. Concerns about higher taxes, the potential loss of employer-based coverage, and the scope of government involvement all temper enthusiasm. For many, the appeal of universal coverage is offset by anxieties about how to pay for it and what it would mean for their current healthcare arrangements. Even assuming a political climate favorable to big reforms, the structural hurdles are daunting. The federal legislative process, with its checks and balances, is designed to make sweeping change difficult. The Senate filibuster remains a powerful tool for the minority to block legislation, and razor-thin majorities in Congress often mean that even modest proposals require intricate negotiation and compromise. Industry resistance is another formidable force. The healthcare sector, private insurers, pharmaceutical companies, and hospital associations ranks among the most powerful lobbying groups in Washington. Their financial resources and political connections ensure that any plan threatening their interests will face intense opposition, both in Congress and through public messaging campaigns. Given these realities, the near-term prospects for a national Medicare for All system remain slim. Incremental reforms are more likely to gain traction. These could include lowering the Medicare eligibility age from 65 to 60, expanding Medicaid in states that have yet to do so, or introducing a public option in the Affordable Care Act marketplaces. Each of these steps would expand coverage and move the country closer to universal care, but they stop short of a single-payer system. Over the next 20 years, however, the possibility of full federal single-payer coverage cannot be dismissed. As millennials and Generation Z become a larger share of the electorate and take on leadership roles, their support for universal health care could reshape the political calculus. If generational turnover continues alongside sustained grassroots pressure, the 2040s might see the conditions necessary for transformative change. While the federal path is challenging, the states offer a different avenue for progress. Historically, the U.S. has often served as a laboratory of democracy, with states pioneering bold reforms that later spread nationwide. The push for universal health care is no exception. States like California, New York, Massachusetts, and Illinois, all with large Democratic majorities and a history of progressive policymaking, are at the forefront of these efforts. Public support for universal coverage is generally higher in these states, and several have already implemented programs that expand access well beyond federal minimums. Massachusetts, for instance, enacted near-universal coverage in 2006, a blueprint that informed the Federal Affordable Care Act. However, state-level efforts to create true single-payer systems face their own unique hurdles. Unlike the federal government, states cannot run deficits indefinitely or print money to cover shortfalls. Funding a comprehensive system would require significant new taxes or other revenue streams, a prospect that often triggers political pushback even in liberal states. Moreover, states rely heavily on federal programs like Medicare and Medicaid to finance their current healthcare systems. To redirect these funds into a state-based single-payer plan, they would need waivers from the federal government, permission that is not always easy to secure, especially under administrations skeptical of such experiments. Recent examples illustrate both the potential and the pitfalls of state-level reform. In California, the ambitious CalCare proposal aimed to establish a single-payer system covering all residents. Despite widespread support among activists and several lawmakers, the plan faltered amid concerns about how to finance its estimated $400 billion annual cost and the political risks of raising taxes. Vermont, another progressive state, came closer than most to implementing single-payer. In 2014, after years of planning, the state ultimately abandoned its Green Mountain Care Plan when the costs proved higher and the funding sources more contentious than anticipated. Despite these setbacks, the outlook for state-level universal health care remains promising, especially over the next decade or two. Demographic shifts, driven by younger, more progressive voters, are reshaping state legislatures, making bold policy experiments more feasible. Labor unions, once wary of single-payer systems for fear of losing strong private benefits, are increasingly supportive, viewing universal coverage as a way to focus bargaining on wages and working conditions rather than health benefits. If the federal government becomes more open to granting waivers or providing financial support for state experimentation, the path forward could become significantly smoother. In this evolving landscape, one or more deep blue states may well succeed in establishing some form of universal health care within the next 20 years. These models would likely be tailored to local needs and political realities, potentially serving as proof of concept for broader national reforms. Success in a large state like California or New York could demonstrate the feasibility and benefits of single-payer coverage, shifting the conversation at the federal level and increasing public support. Beyond the mechanics of policymaking, the larger story is one of generational and cultural change. Millennials and Generation Z, who now represent a growing share of the electorate, are far more supportive of universal health care than previous cohorts. Their lived experiences, shaped by the Great Recession, rising inequality, and the COVID-19 pandemic, have fostered a greater skepticism of the status quo and a willingness to embrace bold policy solutions. As these generations take on leadership roles in politics, business, and civil society, their values are likely to reshape the debate in profound ways. Labor unions also play a pivotal role in this transformation. For much of the 20th century, unions prioritized securing robust private health benefits for their members, a point of pride and a major reason for workers to join. However, the rising cost of private insurance and the increasing instability of employer-based coverage have led many unions to reconsider their stance. Today, a growing number of labor leaders view universal coverage not as a threat, but as an opportunity. If healthcare is guaranteed for all, unions can focus on negotiating better wages, safer working conditions, and other benefits. Public opinion, while still mixed, is also shifting. The experience of the Affordable Care Act, with its expansion of coverage and protections for people with pre-existing conditions, has normalized the idea that government can and should play a major role in ensuring access to healthcare. High-profile debates over prescription drug prices, surprise medical bills, and the impact of medical debt have further eroded the legitimacy of a purely market-driven system. As more Americans grapple with the limitations of employer-based insurance, especially in the wake of job losses or health crises, the appetite for a more comprehensive solution grows. Looking ahead, the most likely scenario is a period of incremental change at the federal level, punctuated by ambitious experiments in a handful of states. Over time, these local successes could build momentum for broader national reforms. If a state-level single-payer system proves effective, lowering costs, improving outcomes, and increasing satisfaction, it could serve as a powerful argument for scaling up the model. Alternatively, a series of incremental federal reforms could gradually expand public coverage, laying the groundwork for a more unified system in the future. Ultimately, the direction of American healthcare will depend on a complex interplay of political will, public opinion, economic realities, and the persistence of advocates for universal coverage. The obstacles are significant, but the momentum for change is real. As the nation continues to grapple with the challenges of access, affordability, and equity in healthcare, the push for universal coverage will remain a central issue, one that may define the next era of American social policy. In summary, while the path to universal healthcare in the United States is neither simple nor assured, the trends are unmistakable. The Democratic Party's base is moving leftward. Generational change is reshaping the electorate, and the limitations of the current system are becoming harder to ignore. Though a national Medicare for all system is unlikely to materialize in the immediate future, incremental reforms and state-led innovations could pave the way for broader coverage and a more just healthcare system. Over the next 10 to 20 years, the country may well witness significant progress toward the dream of healthcare for all, a testament to the enduring power of grassroots activism, democratic experimentation, and the collective demand for a fairer, healthier society.